Hello, everyone, and welcome to the 10th and final edition of the Public Health Management Series that has been created by LAITR in collaboration with the Youth Justice Fund and is being funded by the Blue Cross Blue Shield of Michigan. This week's topic will be on sexual health. In addition, we will provide a conclusion and review of all of the topics we have addressed in the past 10 weeks. On the agenda for today, we will discuss sexually transmitted diseases and sexually transmitted infections, their prevention as well as treatment. We will again review all of the health management topics that we have addressed in the past 10 weeks, and we will offer a conclusion and methods for moving forward with all of the information education provided. So what is an STD? What is an STI? And what might be the difference between an STD and an STI? Essentially, there's no difference between an STD and an STI. They are both umbrella terms. So they are used interchangeably to describe a range of conditions that can pass from person to person through unprotected sexual activity. These conditions can be viral, bacterial, or even parasitic. So STD refers to a venereal disease. So it is kind of considered at this point to be older and less scientific, but it's still more popular and more common. An STI uses the same thing, so it's an umbrella term for those same sexually transmitted infections, and it is considered to be more accurate in terms of a sexually transmitted condition. So as you can see there are various examples of different STDs or STIs. I will use them interchangeably, but again, they mean the same thing, and they are considered to be an umbrella term of various sexually transmitted conditions. So you can see more common ones may know, such as chlamydia, gonorrhea, HIV, syphilis, and there's also different ones that are more commonplace as well, but may be less known. In relation to that, you can see on the infographic on the bottom right that the prevalence of STDs and STIs are maybe more commonplace than one may imagine. So 1 in 5 people in the US have an STI, which comes out to 20% of the US population, which is nearing 68 million individuals going back to 2018. In addition, there was 26 million new cases of STIs in 2018, and almost half of all new STIs were among individuals from the ages of 15 to 24. And the cost for those STDs, STIs totaled nearly $16 billion in medical costs and care. Now that we have an idea on what is an STD or an STI, and as well as the commonality and prevalence of STDs, it is important to consider what are the health effects and ramifications of STDs. So STDs, even if you are without symptoms, can cause serious permanent health problems. STDs, again, untreated, can cause serious and permanent health problems, and you can see here for a few examples are chlamydia. If gone untreated, it can cause pelvic inflammatory disease, chronic pelvic pain, as well as ectopic pregnancy. Gonorrhea, for example, if untreated, can again cause pelvic inflammatory disease, chronic pelvic pain, ectopic pregnancy, infertility, as well as it has the ability to potentially affect the baby's health if you are pregnant. HIV is one of the most common STDs and, of course, can have serious effects if gone untreated. Just some background information. HIV, also known as human immunodeficiency virus, is a virus that attacks the body's immune system. If untreated, HIV will lead to AIDS, which is acquired immunodeficiency syndrome. AIDS is what is considered stage 3 HIV. So if you are someone who has transitioned to that stage 3 of HIV, you have a severely weakened immune system. And individuals with severely weakened immune system, their body does not have the ability to respond to and fight sickness. So even something like the common cold or common health conditions can have serious and catastrophic effects just because the body no longer has the ability to respond to and fight to these conditions. How are STDs as well as HIV spread? So STDs are spread most commonly through unprotected sex of various forms, such as oral, anal, or vaginal, with someone who has an STD. HIV can be transmitted, again, through the same methods of unprotected sex, so anal and vaginal, but it can also be spread through sharing needles, syringes, and other drug injection equipment. In addition, HIV can also be spread through any sharing of bodily fluids, whether blood, cum, pre-cum, rectal fluids, vaginal fluids, or breast milk. It is important to know, since there are a lot of misconceptions, HIV cannot be spread through manners such as air, physical touch such as a handshake, and HIV cannot be spread in any manner except for the exchange of bodily fluids. Also important to know when it comes to the spread of HIV, having STDs can increase your risk of getting HIV. So in the United States, people who have syphilis, gonorrhea, and herpes often have HIV or are more likely to get HIV in the future. If you get an STD, you are more likely to have HIV in comparison to someone who is STD-free. This is because the same behaviors and circumstances that have resulted in someone having an STD is also puts them at increased risk to have HIV. In addition, if you have a sore or there's a break in your skin from an STD, that also leads you to an increased likelihood of getting HIV. Again, it's important to know if you are sexually active, it is important to get tested for both STDs and HIV regularly. So that transitions into how to prevent STDs and STIs. One of the most key foundational starting points is to have a conversation and to have an open, honest conversation about STDs and STIs in order to help prevent them. So in general, you can see being prepared, it's important to have this conversation with your partner or partners before having sex and engaging in sexual activity. So one of the most easiest ways to prevent STDs and STIs are to talk with your partner before having sex so you can both make informed choices about your sexual health. It is important while having these conversations to be open and honest. You should be clear with your partner about the number of sexual partners you have or have had. In addition, while engaging in these conversations, it is important to be understanding. You should be respectful and non-judgmental and create a space for a more productive conversation, including laying the groundwork for future conversations if you continue to engage in sexual activity with this partner. And related to being open and being honest, you should always inform your partner if you have any form of STD or STI. And this includes even if you have an STD or STI and you are currently taking medication to treat these infections. Also, it is important to ask the partner when is the last time they have been tested, and you should also consider getting tested together. Overall, a lot of these same conversation tips when it comes to being open, being honest, and asking can also relate to conversations you would have with your doctor about your frequency of sexual activity, as well as different sexual activities that you engage in. Other ways to prevent the spread of STDs and STIs are to be prepared. So this comes with establishing a game plan for your sexual activity. So a lot of that comes with what we just discussed previously, which is having the conversation before engaging in sexual activity. And other ways to be prepared to help prevent STD or STI spread is to use condoms. So again, going against making sure the sexual activity you engage in is protected. In addition, other ways to prevent STD, STI spread is through vaccination. So the HPV vaccination is recommended for preteens from the ages of 11 or 12, and it can start as early as 9 years old. It's recommended for anyone up to age 26, if not already vaccinated. Even individuals who are between the ages of 27 through 45 who have not been vaccinated can decide to get the HPV vaccine after discussing the risk and benefits with their doctor. In addition, most individuals receive 3 doses of the hepatitis B vaccine in infancy, but if you have not already been vaccinated, you can consider, again, the risk, the benefits of this vaccination, and discuss this with your doctor. And there are certain cases and conditions in which individuals who are 60 years and older should consider doses or the hepatitis B vaccination. Other ways to prevent the spread of STDs include limiting your number of sexual partners, mutual monogamy, which is deciding to have sexual activity with one person, one partner only, and finally, as mentioned, using condoms. When it comes to the spreads of AIDS and HIV, a lot of the principles for STDs overlap. So engaging in safe sexual practices and participating in protected sex, so condom use. In addition, PrEP is a medication that helps to reduce your chance of getting HIV from sex or other injection drug use. So PrEP is taken if you are someone who does not currently have HIV and it has a high efficiency when it comes to preventing HIV. Other ways to protect yourself from HIV includes protecting yourself if you inject drugs. So of course, the most straightforward is to never inject drugs, or you decide not to use shared needles, or again, PrEP is a method to help to prevent the obtainment of HIV. In addition, it is important to protect others if you do have HIV. So if there is HIV medicine available. It is called antiretroviral therapy, or ART for short. And it's important to know that taking ART does not prevent the transmission of other sexually transmitted diseases. In relation to that, as we discussed previously, if you do have HIV or any other sexually transmitted disease, it is important to share this information with your partner or partners. In relation to HIV, this can also be spread from mother to child. So trying to prevent that transmission can include getting tested, taking PrEP, or also taking ART and other medicine to treat. As we have discussed throughout, testing is a huge piece when it comes to preventing STDs as well as getting appropriately timed treatment if you do have an STD. So how do you decide which test is right for you, and where do you find testing locations? In the presentation materials provided for this presentation, page 2 is a link to testing centers, is a link to the CDC website, and that gives you information on different testing centers in your area. So all you would put in is your zip code or your city and state, and you can find local testing centers that will offer testing at free or low cost. And then when it comes to other information in regard to how often you should get tested or which tests you should get, it is important to know all adults and adolescents from the ages of 13 to 64 should be tested at least once for HIV. In addition, all sexually active women younger than 25 should be tested for gonorrhea and chlamydia every year. Women who are 25 and older who have increased risk factors for STDs should also and continue to be tested for gonorrhea and chlamydia yearly. If you are pregnant, you should be tested for syphilis, HIV, hepatitis B, and hepatitis C at the start of your pregnancy. Those who are, again, at risk or increased risk for chlamydia and gonorrhea should also be tested during pregnancy. In addition, all sexually active gay, bisexual, and other men who have sex with men should be tested at least once yearly for syphilis, chlamydia, and gonorrhea. Those who have multiple or anonymous partners should be tested more frequently than once a year. So tested either once every 3 months to once every 6 months. In addition, the same category of sexually active gay, bisexual, or men who have sex with men should be tested yearly for HIV, and again, may benefit from more frequent testing. In addition, if you are living with HIV, you should be tested at least once a year for hepatitis C. It is important to know anyone who engages in sexual behavior that could place them at risk for infection, or anyone who shares injection drug equipment should be tested once yearly for HIV. And also to know anyone who has oral or anal sex should talk with their healthcare provider about throat or rectal testing options. So beyond prevention and beyond testing, we eventually should transition to the discussion on treatment. As mentioned, it is important to know that even if you don't have symptoms, untreated infections can lead to serious permanent health problems. So most STDs and STIs are treated with common antibiotics. So your regular doctor can prescribe you antibiotics to cure your STD. But if you don't have insurance or you want to see someone else for treatment, there are other low cost and free options available. You can get tested and treated at your local health department's STD clinic, a family planning clinic, a student health center, or an emergency care clinic. You can also find a clinic using gettested.com or ask if they have other treatment options for gonorrhea and chlamydia. And again, if you are looking for low cost and free testing options as well as treatment options, you can refer to the presentation materials and use that CDC link. In relation to treatment, it is important to know that there is currently no effective cure for HIV. Once someone gets HIV, you will have it for life, but with proper medical care, HIV can be controlled, and people with HIV who get effective HIV treatment can still live long, healthy, happy lives. So again, we've discussed some of the manners for preventing HIV, such as PrEP, and then we've also discussed ART as a treatment option for HIV. Overall, to recap this discussion, it is important to get tested, talk with your partner or partners, to get treatment, and then to get retested after if you have been diagnosed with an STD. In transition, this is the second portion of this presentation. We'll discuss the various health topics that we have discussed throughout the 10 weeks of the LAITR health management series. So you can see in weeks 1 through 5, we discuss things such as type of health, healthy habits, managing health conditions. In the weeks 4 and 5 were a discussion on mental health and trauma. Weeks 1 and 2 especially were key discussions that laid the foundation for different pieces of education and different habits to develop that integrate the rest of the information. So if you have not watched the weeks 1 and 2 presentations, I would encourage you to go back to those presentations because it provided some of the most baseline foundational stuff that continued on to the rest of the weeks. Week 6 was a discussion on nutrition. Week 7 was sleep. Week 8 was exercise and ergonomics. Week 9 related to substance use, and week 10 was this current presentation on sexual health. As we created these topics and created these presentations, our expected outcomes were improved knowledge of healthy behaviors, increased confidence in the implementation of healthy habits, and an individualized plan for implementing habits for healthy living. So that individualized plan was provided in the week 1 presentation resources materials. And as we move forward, I want to again share the second half of the presentation materials. So this PDF, which again can be found on the Life After Incarceration website, outlines all of the different materials that were provided from week 1 to week 10. So as mentioned, if you were looking for something like the individualized plan, you would go back to the session 1 types of health presentation, or you can follow the link in this PDF that will take you directly to the session 1 types of health presentation. And throughout this PDF on pages 3 and 4, you also have a good outline and idea of the rest of the resources that were provided to you throughout the past 10 weeks of our health management series. So you can see sessions 1 and sessions 2 were some of those foundational things I talked about, such as individualized plan, the Wheel of Life assessment, as well as habit trackers and different activities and ideas to support creating and implementing a successful routine. And then weeks 3, 4, 5, and beyond address different health topics that provided resources that pair well with some of our habit trackers and our routines. So you can see these are the resources provided for managing health conditions, different resources, tools, and supports for managing mental health, as well as effects of trauma. This is the presentation materials for nutrition. Week 7 presentation materials support sleep, healthy sleep, quality sleep. Week 8 address exercise and ergonomics, as well as how to develop a healthy exercise routine. And then finally, on week 9, you have resources related to substance use. So again, as we wrap up these presentation and look to move forward with all the information that we now have from participating in weeks 1 through 10 of the health management series. Some of the different actions you can do moving forward is to complete or recomplete the Wheel of Life, which again came from the week 1 types of health presentation materials, and you can also find it in the link on the PDF that I just discussed. Other options as far as moving forward and continuing to utilize all the resources provided. You can do something such as reconsider your stage of change and where you're at with your behavior change. In addition, you are encouraged to go back to the week 1 individualized plan and rewrite your goals, as well as identify new strategies that support your new desires to participate in healthy activities. Now that you've participated in weeks 1 through 10 of the health management series, you now have a variety of resources that can be used together and integrated into your daily routine. So this might look like something like, now that you have foundational knowledge on exercise as well as healthy habits, you've decided to include exercise on your habit tracker, or you have viewed the mental health and trauma presentation and you've decided to add relaxation techniques into your routine or weekly planner. And finally, if you have questions on any sort of anything related to these presentations throughout weeks 1 to 10, you are encouraged to contact either myself with my email listed below, or you can contact Ariana with her email also listed below. We would like to again give a shout out and a thank you to Youth Justice Fund as well as Blue Cross Blue Shield of Michigan for sponsoring and funding these presentations of the past 10 weeks. And finally, if anyone is interested in bringing the health management series into a live group, again, please contact Ariana or myself. We highly encourage the live format as it allows us to deliver the materials and education, but also provides us the opportunity to support the materials and strategies to help with the transfer of knowledge and support the implementation of the materials and education into the participants' lives and well-being. So thank you again, everyone, for participating in these past 10 weeks. And again, with questions, comments, or any continued interest, please contact either myself or Ariana at the emails listed. Thank you.